Dr. Deepak Kapoor is here with the AUA Office of Research talking about the Symposium for Independent Practice Researchers. Thank you so much for joining me.
Thanks for having me.
Tell me about the goal of this symposium.
Really, it's to go ahead and have people in independent practice understand that there's a role for them in research, and the AUA recognizing that that role exists and trying to fill the void to provide a bridge, because so many patients are being seen in the independent practice setting. You know, very unfortunately, urology lags behind other specialties in terms of the degree of research funding, especially with NIH grants. And it's really important that we continue to press forward and expand the fund of urologic knowledge. And so the chairman of the AUA Research Committee or Council, not sure what it's called, Dr. Stephen Kaplan, made one of his priorities to expand the outreach for the AUA into the independent practice community to develop researchers to foster an interest in research, and for those people that are doing research to increase the opportunities that exist for them in their research programs.
Wonderful idea. What impact do you think the symposium will have in terms of putting this into action?
Well, I think that we were pretty excited. We had great turnout. Turnout was, I think, the second highest of all the symposiums, and most of them have been going on for multiple years. So we had a lot of people come in and out of the meeting, and that is really gratifying. I think that the researchers that were there, I think there were a lot of tips and tricks, so they're going to be able to take that back to their practices and do it better. And I had a number of people come up to me and say that, wow, this is really inspiring, and they may want to go ahead and get these programs started. So I think that the biggest impact for me for this particular symposium is not necessarily what will come out of this meeting, but really serve as a seed that we can germinate for future meetings and future development. So the mere fact that that at this meeting, when there's so much going on, that so many people stop by the meeting, will serve as the nidus for the AUA to continue the efforts. We had a lot of industry participation at the meeting. That was one aspect of the symposium, which was how do you create a collaboration with industry partners? And I think that that's something that's really often overlooked. But the partnership between industry and researchers is really important.
I think the key to the collaboration may be talking about the influence on the non-academic urologists and how they will be impacted.
Not only on the non-academic urologists, but on the academic urologists as well, because the pressures on academic urologists are such, and we had a wonderful panel with some very distinguished academicians, and the pressures on academic physicians to produce clinically has greatly increased. And so their ability to have preserved full-time research is becoming really constrained. So a way that they can expand their passion and their interest for research is to develop collaborative relationships with independent practices. So they may have a lot more clinical obligations as well, but if they recognize that there are people in their community that also have a passion for research and everybody works together, then I think that it can foster education on both sides, you know, the quote unquote town and gown, because really there is no such division. We're all here to take care of patients. There's not enough urologists in the United States. There's not enough people doing the work. And for us to continue to thrive as a specialty, I think it's really important for us to identify ways that we can collaborate together and expand the knowledge in our field for the good of our patients.
Yeah, working together for the greater good of urology.
You know, that's probably the takeaway message from the whole thing.
All right, thanks, Doctor.